Hey everybody out there listening. On behalf of the Quality Assurance, Quality Improvement team here at Allegiance Mobile Health, my name is Adam Baer, and this is your Medic Minute. In today's Medic Minute, we will discuss high-risk EMS refusals. This segment will feature information from the MCHD Paramedic podcast titled High-Risk EMS Refusals. Dr. Casey Patrick and his team over at Montgomery County Hospital District put together some outstanding educational content, and I encourage everyone to check out their podcast if you have a chance to. So moving right along, as EMS professionals, we always have our patient's best interest in mind. So this Medic Minute will serve as a review of some points to consider when obtaining a patient refusal. The first thing that we should talk about is mental and medical capacity. When discussing the patient's mental and medical capacity, we must make sure that these 4 requirements are met before allowing them to sign a refusal. The first is that the patient must understand that there is a decision that has to be made. The patient must understand the risks of the decision, the patient must be able to verbalize these risks back to us, and the patient must be free of coercion or outside influence. A tool that we have at our disposal here at Allegiance Mobile Health is the paper refusal form, specifically sections B and C, which cover mental and medical capacity. While utilizing these checkboxes is a great piece of supporting documentation, it is imperative that we elaborate further in the narrative in the event that the patient checks yes to any of these items. Moving along, we are going to utilize an easy-to-understand mnemonic to help guide us through these high-risk refusals, and that mnemonic is FEARS. So when discussing FEARS, the first letter, F, stands for Full Exam with Vitals. For each and every patient with a medical or injury complaint, they should have an exam and their vitals signs checked as they allow. Remember that underlying medical conditions such as diabetes, hypertension, hypoxia, sepsis, and so on may hinder their ability to make rational decisions. If a fully alert and oriented patient refuses an exam and or their vital signs being assessed, make sure that you are documenting this clearly in the narrative. Next we have E. E stands for Explain Real Risks. As EMS providers, we know that there are some serious potential risks when our patients want to refuse care or transport. We have a duty to inform them of these risks before having them sign a refusal. For a long time, we in EMS have used the saying up to and including death when verbalizing risks to our patients or when writing a patient care report. Sometimes it is completely warranted. Let's say for a chest pain patient that has all the telltale signs of a potential MI and all the risk factors to go along with it. But other times, we need to be more realistic when relaying the risks of refusal to our patient. For a stubbed toe or an ankle injury, there's no need to include the phrase up to and including death. Instead, we can inform them, for instance, that there could be a problem with circulation that could be dangerous to the foot, or that if there is a fracture, it may heal incorrectly, causing them chronic pain or trouble walking in the future. Make sure we explain the risks and that we keep it realistic given the patient's presentation. A stands for Ask for Assistance. Here at Allegiance, we have a structure that allows and instructs you as paramedics and EMTs to contact your on-duty supervisor prior to obtaining a refusal. We also have Dr. Hart, who is always just a phone call away to give input if we should have a patient wanting to refuse, even though we may believe that they truly need emergent care. For a fully alert and oriented patient without an underlying condition that may inhibit their decision-making, we have to always respect their decisions. But perhaps we can get a family member involved who is on scene. Even though we may be the ones with the medical knowledge, sometimes our patients just need to hear it from their loved ones that maybe now is a good time to go get checked out. Next is R, and that is to accurately record the conversation. As cliche as it always sounds, if it wasn't documented, it didn't happen. Remember that refusals are the most highly litigated charts within EMS, so it's important that we paint a clear picture of not only our assessment findings, but also our conversations surrounding the events that are leading to the patient refusal. Notice that this goes beyond saying that the patient may be A&O times 4 or have a GCS of 15. Ask the patient to verbalize all the risks that have been explained to them so that we know as providers that they're comprehending what's being said. The final letter is S, and that's having a supportive attitude. As we discussed earlier, we must be respectful of the patient's decision, so long as they have the capacity to make that decision, and even then, we still remain respectful. Even if we have done the F, E, A, and R perfectly up to this point, it can still all come tumbling down if we fail to be supportive. As Dr. Patrick highlights in his podcast, studies show that jerks are the ones who get sued. The way you treat your patient is going to be more memorable to them than any of the treatment interventions you may perform. Let's make sure that we are completing a thorough assessment, giving the patient facts, record our conversations accurately, and finally, be supportive of their decision should they decide to refuse care or transport. Remember that what we may see as irrationality may simply be the patient's fear of the unknown of going to the hospital, or fear of something like catching COVID, which is a refusal reason that we see in many charts. So in conclusion, remember that we must determine that our patient has the appropriate medical and mental capacity to refuse care before allowing them to do so. How do we do this? By performing a detailed exam with vitals, which we identified as the F in the fears mnemonic. If you have the opportunity, I would encourage everyone to listen to Dr. Patrick's full podcast, which I will link in the description below. He goes more in depth with the mnemonic and also presents some good case studies regarding high-risk refusals. If you have any questions, feel free to reach out to your supervisor or anyone on the Quality Assurance Quality Improvement team. As always, thank you for what you do, stay safe, and have a great day.